Hi, this will be the first talk on diabetes. I'll talk about the problem. So in the first video, I'll highlight the problem. The second video, I will show the solution. The third video, I will talk more about how the body functions. The fourth video, I will explain some common misconceptions on diabetes. And in this video is to warn people how dangerous diabetes is and how important it is to prevent or reverse it. So why is diabetes so dangerous? Diabetes can cause all these listed diseases. So hypertension, heart attack, stroke, kidney problem, liver problem, Alzheimer's disease, osteoarthritis, gout, PCOS, infections, cancer, pneumonia, fibrosis. So every part of the body, whether it's the head, the lungs, the liver, the kidneys, will be affected. Right? How I know it causes all this is because diabetes is a risk factor for all these diseases. The question is not how diabetes can cause all these disease, but the question is which disease is not caused by diabetes, because everything seems to be caused by diabetes, correct or not? So, and it is the most common risk factor for leg amputations as well. So this is according to research, there is 8.8% of worldwide population having diabetes, and it is going up every year. The rate is going up, very scary, because it will go up by 10% in the world, around there lah. So in Malaysia, we are close to 19% now, around so 1 in 5 close to 1 in 5 adults. Adults means I think above 18 years old. Okay, so we are the 12th highest in the world, and we are the highest in Southeast Asia. So compared with Singapore, we are even higher. Okay, look at Brunei, China, US, Thailand, India, Hong Kong, Philippines, South Korea, and Japan. We eat, talk about Singapore. Singapore is just south of the border. Thailand is just north of the border. So why is our diabetic prevalence so much higher? We eat similar food to these countries. So what is wrong? I think first is lack of nutrition. We don't eat enough fruits. Second is we don't exercise enough. You see Hong Kong, they exercise a lot because everywhere you go to Hong Kong, everybody is walking everywhere, right? There's no place to drive because it's going to be jam. You can't drive. Whereas in Malaysia, we drive everywhere and we walk very little. So it could be exercise. The third could be toxic chemicals, maybe pesticides, which can cause various diseases. Now we look in other countries, they are already warning the rate of increase is very high. Okay, and in COVID-19 death, for every 10 deaths, I think 7 or 8 were diabetic. In dialysis centers, 8 out of 10 are diabetic, 7 have hypertension. So diabetes is an expensive disease. If you look at the official amount spent in 2017, this is 6 years ago, it was 4.4 billion. It is even higher than cardiovascular disease and higher than cancer. Diabetics medication will cost anywhere from 500 to 1,000. Of course, on various medications, supplements, and insulins. Even though the government hospital can give you free medication, don't be penny wise, pound foolish, because what happens when you get on dialysis, it will cost 25 to 30,000 a year. If you live 10 years, it is 300,000. So prevention is obviously better than cure. what are the other problems we have to, the obstacles that we have to overcome. First is the doctors themselves are, some doctors are themselves diabetic. They themselves have big tummy, they themselves are sick and fat. They don't know how to bring diabetes into remission. They don't know how to deal with the problem themselves. They themselves may have the problem. Correct or not? If you see a fat doctor, okay, and because why? Because the medical education teaches them how to prescribe drugs. They do not know how to prescribe lifestyle changes, how to change your diet or how to exercise more. So diabetes, why? Because you see, diabetes is the problem is because you eat, the input is more than output. Okay, so whatever you eat turns into sugar. Okay, of course fat remains as fat lah, but whatever you eat is stored as fat. Okay, whatever excess means cannot burn, that you cannot exercise, become fat. So the fat, research has shown the fat affects the beta cells in the pancreas, so they cannot produce enough insulin. Of course, there are many other factors, but this is the only reason because input is more than output. Of course, I'm talking about diabetes type 2, not diabetes type 1. And you see, the sugar that we eat don't come out as urine, right? It is reabsorbed in the kidney. The sugar will only come out in the urine when the blood glucose is 10 to 11 millimoles per liter. That means when you already have diabetes, then only sugar will come out. If you haven't reached that level, the sugar turns into fat. So can the drug solve the problem with the fat? Cannot. Okay, so whatever drugs is just to maintain the blood sugar level. It cannot solve the problem. That's why in medical literature, when they teach the doctors, they write in the book. Okay, I read the textbook. They say it is forever, permanent. You cannot cure it. Okay, so the fat is stuck in the pancreas. But in around about 5 years ago, there's a study in UK. They scan the pancreas using MRI before weight loss. Okay, before the person cure the diabetes, so-called reverse the diabetes, and after reversing. The difference in the pancreas is a lot of fat before, and after no more fat in the pancreas. So the pancreas then start to produce insulin. So this shows the conclusion of the research shows that fat loss is the one that helps you to reverse diabetes. So fat loss is the goal of treatment. So if you want to find out more, you can email me. I can advise, because I'm not a medical doctor, but I can advise on how to diet and how to exercise. And if you want to know anything else about diabetes, I can tell you. But I cannot tell you how to take drugs, which drug to take, which drug to stop taking. Okay, thank you. Bye.